Developing amazing leaders has never been more difficult than it is today. That's why in our next episode of the Flourishing Workplace podcast, we have Dr. Jan Jaffer, the CEO of Trek Dental, who's going to share with us some of his best secret strategies for developing amazing leaders for today's workplace. We'll see you there. Welcome to the Flourishing Workplace podcast. Join today's leaders as we explore what it means to thrive at work, with purpose, safety, and strength at the core. Flourishing Workplace is changing the world by changing the workplace. Hey everybody, welcome back to our next episode of the Flourishing Workplace podcast, and great to have Dr. Jan Jaffer with us. Welcome, Dr. Jan.
Great, thanks for having me.
Hey, thanks for being here. In our last episodes, Dr. Jan has really talked us through the journey with Trek Dental here in Calgary. And of course, that is a story you're going to want to hear. So check out those episodes if you can. In those episodes, Dr. Jan, you talked about how you went from one clinic as a start, and this was, several years ago now, to 19 different clinics across our city, which is awesome. To me, when I hear that, I don't just think about the business growth and some of the operational challenges, but I think there has a lot of leadership development that's gone into that. So can you just talk us through some of that process? Because I know that business owners and people tuning in, developing leadership bench strength is a real challenge today.
Yeah. And it's a challenge for us, right? Trying to find the right people to be leaders over time can be challenging. The one thing for us that we've always focused on is, having some level of ownership. And so each of our offices actually has a partner.
Okay.
And that partner will own 30 to 50% of that office.
Mm-hmm.
And so what we know is when we have a partner that's bought in, that's actually part of the business, that actually is again, an owner in the business, they're going to treat it a little bit differently. And that kind of sets us apart from sometimes some of the other larger organizations out there, is that it's not being run by a management team at the top with one owner and all of these pieces. It's actually individual partners that truly care. And they've come through the system. They've worked with us. They've been an associate. They understand, the systems that we have, how we treat patients, our values. Mm-hmm. And then they're allowed to open their own clinic and take that to a new group of people here in Calgary and just really expand the ability to do ideal treatment and help others.
Mm-hmm. Yeah, I love that. And I think about the fact that every one of us in our job, whether it's formal leadership, formal ownership from a legal perspective, or just having the capacity to make better decisions, I think that's such a critical part of mental health. People talk about mental health as if it's something that's external to you. But, the research shows that having a sense of empowerment and agency is so important. And so you're in a highly regulated profession. So obviously you can't just have a free-for-all every day. But how do you find that balance between obviously following the regulations, it's medical, it's healthcare, and yet creating some sense of agency and ownership for people?
Yeah, so that's great. So, we obviously have systems. You have to have systems when you have this many offices. But ultimately, if you were to experience each office, they're going to be slightly different because the partner gets to really set some of that tone and create some pieces around what's going on. And what was really interesting for us is, a number of years ago, we'd had so many offices, we said, let's put some kind of middle management in, right? So we call them team leads. We don't like office managers as a term because we feel that they're leaders as well. So again, building leadership starts with the terminology that you're using. Mm-hmm. If you create a team lead, they're now a leader, not an office manager. And so our team leads, at all the different offices. And so we found a couple of people, one in the south, one in the north, to kind of go in and see what was happening. And ultimately, that actually turned out to be one of the worst things that we could have done because it took that agency away. It took that ability to make their own decision. These were smart people that were already doing really well.
Right.
And we're like, we want to make sure the systems are being followed. Mm-hmm. So let's send somebody in to check. But as soon as somebody does that, it feels like Big Brother coming in, and it doesn't feel as good. And so for us, interestingly enough, it was going back to these leaders in the office and saying, hey, let's help you make sure you're doing it. And then if there's a problem, come directly to us. We don't need the people in the middle. And they were so much happier when we removed management, which, funny enough, for business, you'd think that would be worse or better, but you actually save 2 people on the payroll, and the team is actually happier because they get that, it runs better. So it was really interesting because we tried it out because we thought that would be a good idea. And we learned within 12 months that it wasn't a great idea because our teams were doing a really good job already.
Yeah. And that's such a critical part of creating healthy workplace culture is that accountability to the systems, right? But not creating this micromanaged type environment, which is very difficult for people, right?
Yeah.
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 So, have you had any challenges when it comes to developing leaders? And if so, what have those challenges been, and how have you been able to handle those?
Yeah. So, I mean, I think the biggest challenge we have is when you're looking for a leader, you've lost one, right?
Right.
So, like if we've lost a team lead at an office, we need to find somebody. And you're like, well, have we trained somebody into that role? There's not enough people. And so the big challenge that we have is that when you're looking for somebody, they won't have the skill set.
Hmm.
And then you put them into the job and they need to do the job. We don't have time to take them for 3 weeks of training before we put them in the job. So it's something that, to be honest, we still struggle with.
Hmm.
It is one of our struggles, is how do we get new people into the organization trained up as quickly as possible
Yeah.
when ultimately they have to be serving patients day one that they're there, because otherwise we wouldn't be looking for them.
Right.
And so trying these, mentorship, like working with different offices, we've got these group chats where they can ask questions amongst each other and,
Hmm.
get some pointers, and then taking them when we do have time out of their office and putting them in another office to see what another leader would be doing. So
Hmm.
learning from each other. And that's what we're trying to lean into a little bit more. I'm not sure that we're doing a fantastic job yet, but leaning into, the mentorship piece again, finding somebody else that can help you get better at what you can do. Because we talk about it, like, how do you get better at things
Hmm.
when you go to learn it
Hmm.
or you get some feedback,
Hmm.
right? And feedback's really important.
Yeah. And that's both being able to give it effectively, but also are you able to receive it, right, effectively?
That's the toughest part I find. And so we always talk to people because I'm like, hey, do you want to give feedback? And people are like, well, it's not easy giving
It's
feedback, right?
hard. Yeah.
And I'm like, well, why don't you want to give feedback? And they're like, and I'm like, it's because of that primary, the biggest fear in life for anybody is rejection, right? And so we
Hmm.
know our natural biggest fear in life is rejection. I
Hmm.
don't want to give you feedback if I think you're going to like me less.
Hmm.
That's not good for me.
Hmm.
So we've flipped that and we've told our teams that our goal, and not that it happens every day, but our goal is that you ask for feedback once a day,
Hmm.
but in a specific environment. So
Very
don't say,
cool.
hey, how did today go?
Right.
That's a bad question,
Right.
right? And humans are really good at asking bad questions. That's the one thing that we,
Yeah.
I work with our kids, and
Mhm.
as a parent, I work with that. Ask a better question because you get a better answer.
Yeah, absolutely. I mean, hey, and if you just ask such a general question that's vague, it's almost meaningless,
It
right?
is.
And so let's be specific. So, of course, this being 2025, as business owners and leaders, we always want our employees to have voice. We want our teammates to feel as if they're heard, that we have psychologically safe environments. And so, what are some specific things you guys have done in your community? I mean, a moment ago, you mentioned some group chats and things like that where people can ask questions and give voice to things. What are things that you have done to create that kind of environment?
So, I mean, for feedback or for just, trying to improve things or, like looking at that, we have a couple of different ways of doing that. And one is we call it the spike list.
Okay.
And so the spike list, it goes back to like the restaurant industry where, you write something down, you put it on a spike, and we can always go back and we can look at it or see what's on there. So each
Nice.
office either has a suggestion box or a spike list. And
Nice.
what we're trying to do is if there's a problem or something's going really well as well,
Hmm.
they can write it down there. And we have a morning meeting every day. So
Okay.
that's part of the systems that we have in ours, is that we come to work 15 minutes before our first patient,
Yep.
and 10 to 15 minutes before the day starts, we all get into a room and we all go over what's going on in the day.
Okay.
And we go through those things on the spike list to make sure that if there's some problems, that we can get some stuff better.
Yeah.
If there was something that happened that was really good yesterday, we can do it.
Hmm.
And then we also have a bit of a more of an anonymous way of doing it. There's an online form that you can fill out. Hey, there's
Yeah.
a concern going on at the office. And then it allows us to step in and try to, again, help people, because ultimately, if they're willing to bring up a concern, it's probably pretty serious at that point.
Yeah, absolutely. And it's really important that they have those forums to do that. So, zooming out a little bit, then, I mean, you're in the Canadian environment, you are in the North American environment, you travel globally. What are some pieces of advice that you would give to leaders listening to this conversation today, really specific to developing that leadership bench strength? I mean, you already mentioned you don't have it perfect,
Yeah.
but you've learned a lot. And so, what would be a couple of specific things?
So I think, and it's a challenge for leaders because once you get there, is listen first.
Yeah.
And it's really hard because we have a lot of answers, right? And I
Hmm.
know that, one of the things that goes on in my head is I think of every problem and then I think of every solution to that. And so when somebody's coming to me with, hey, have you thought about this? The answer is probably yes, but that's not building leadership.
Yeah.
So the answer is like, no, what do you think about it? And
Mhm.
that's what I try to, tell our team is I want problems, but I want you to come up with your best solution. It doesn't
Right
mean that
on.
we're going to use it, but come up with something, because a problem without a solution is a complaint.
Right.
And I don't need more complaints. We talked about this earlier. There's
Mhm.
enough people complaining already in this
Yeah,
world.
absolutely.
So, come up with a solution. And that, I think, really helps build leadership, because if you're coming up with a solution, you're thinking through the problem and you're thinking through how we can do it,
Mhm.
but ultimately think through the rest of it. And, I learned something from actually the CEO of Earl's a little while ago, a number of years ago. And he said, when a chef comes up with a new dish, they're not allowed to just say, does it taste good?
Mhm.
They have to come up with, how much tinfoil does it take to store the container that it's going to be in? Which dish is it going to fit in? Which plate is it going to go on? Because if they've created all of that, now there's a system for being able to do something,
Right.
where other people are like, oh, let me just come up with this. And it's like,
Right.
no, that's leadership. Is you got to be able to come up with the problem, come up with the solution, but then figure out how we're going to implement, because implementation
System.
is much harder
Yeah.
than actually coming up with the solution.
And it's a lot harder than complaining, right? So
That's the easy thing.
absolutely. Well, thanks so much, Dr. Jan. What a great conversation. And so how could anyone listening today get a hold of you or follow Trek Dental?
Yeah. So if you want to follow me, Instagram, Dr. Trek,
Mhm.
LinkedIn, Jan Jaffer. And if you want to learn a little bit more about Trek Dental, trekdental.com is probably the best way to figure that out.
That's fantastic. And they do great work. And so thanks, Dr. Jan. And please do join us in our next episode, where we're going to continue the conversation with Dr. Jan and particularly drill into some of the challenges they faced as they have been able to move forward successfully. Thank you. Thanks for tuning in to the Flourishing Workplace podcast. Let's keep building spaces where people can thrive. Until next time, lead with purpose, and let's let our workplaces flourish. At Flourishing Workplace, we're changing the world by changing the workplace.